So what we tried to do was to put all these solutions in a box and then ask these eye mitras or the primary eye care providers to literally go house to house in every village and every small town and conduct eye examinations with the same level of quality as what a patient would get anywhere in the big cities. Now, this was a huge, this created a huge impact. So when COVID struck, obviously it affected people's lives and it affected them. But along with that, it also affected the whole economy, it affected the businesses, it affected the consumers because the whole focus was on solving COVID and the whole healthcare system was working towards that. But then the other ailments like eye diseases or any other diseases, for instance, were kind of taking a back seat because they were not on the priority, rightly so. But then we said, what can we do at this stage? Because there is also a need for that to happen because you can't ignore them forever. So this is the example I wanted to share with you. So sometime back, with the innovation lab that we have, we set ourselves on a task to create simple diagnostic tools. Now, simply diagnostic tools, as most of you would have visited optical shops or ophthalmologists, the first step is to actually sit in front of a machine called a autorefractometer, which costs anything from 3 to 10 lakhs, which gives you the first set of prescription. And then the optometrist or the ophthalmologist refines those prescriptions sitting on a chair with a trial set of lenses, etc. So the challenge we said that if you have to reach 2.5 billion people, there is no way you can actually have equipments worth 10 lakhs going around into each and every small village. So we had an open innovation challenge to create a simple diagnostic tool, which will have no battery, no electricity, which could be portable, which could be carried in your handbag or your briefcase, and which would be as accurate. The fact is that we did come up with a solution which costs less than 2,000 rupees, which actually works to about 98% accuracy like any of those big machines would do, and which can actually carry in your box. So then this was something which came up actually right before COVID. But what we did was to accelerate the scaling up of this, to set up production facilities in China and other places so that we could produce huge quantity of them, which can actually be given to various people to go and do the first simple first simple test to check a good eyesight or not. So this was Eyecare in a box. So what we then did was we have a network of primary eye care providers called iMitra, whom we train and we give them grants to go and start primary eye care centers in far-flung villages. We gave them this box. And at the same time, we were working on a connection through Tele optometry, which is an Uber-like model, where each iMitra had a facility to connect as soon as he gets a patient. He throws up the job on the ether. There were 200 optometrists anywhere at any point, always connected. Anyone who's free picks up the job, would then connect online with the iMitra and go through the process of eye examination and refraction remotely, and finally sign off a prescription, which would then be delivered instantaneously by WhatsApp. So what we tried to do was to put all these solutions in a box and then ask these iMitras or the primary eye care providers to literally go house to house in every village and every small town and conduct eye examinations with the same level of quality as what a patient would get anywhere in the big cities. Now, this was a huge, this created a huge impact. First of all, there was a question of livelihood of the iMitras because nobody was coming to see them because of COVID. So they were then actually going and seeing patients. And secondly, for those patients or consumers in their houses, they could get the refraction done remotely and with the same kind of facilities. And they had access to good eye care, which actually helped them to see better and live better. So this was a simple innovation which we did. As of now, we have over 1,000 digital iMitras, as we call it, who are in really, really remote locations in India. And this is kind of leading the way for us to do the same thing in other markets like Bangladesh, Kenya, Indonesia, and even China. So actually, we are taking this innovation global. There's another thing which I wanted to give is that the impact of the innovation which was focused at the low end base of the pyramid market had on the big cities. Now, obviously in the cities, the situation was while the facilities were there, people were scared to go and see an ophthalmologist or an optician because they were scared of getting the infection. So they were postponing the tests. They were postponing their eye examinations. And the agony was they were spending more times in front of a computer or machine, probably much more than ever because of all the Zoom calls and everything. So they needed eye care support, but they could not get one, or they did not want to go because of the fear of infection. So what we did was turned around and created a new business model where, again, the same thing, where people could go house to house and offer them free eye examination. And also they could take an image of the eye and transfer it to an ophthalmologist who could then read the condition of his eye and diagnose if he's got cataract, diabetic retinopathy, or all kinds of other eye diseases could be done with the simple image of the eye. And all this was able to be done remotely, which helped to create a new way of creating eye care access, even in the cities. And at the same time, even large organizations like large companies encourage their employees to get their eyes examined remotely, either at their workplace or at their home. And honestly, we've discovered a new business model in this whole COVID time, which is actually going to be scaled up, and even post-COVID, which actually is going to be probably the new way of getting your eye care delivery done in future.